is Karsten Roberts. I am a staff respiratory therapist at the Hospital of the University of Pennsylvania in Philadelphia. I'm also an adjunct faculty member at Boise State University in our degree advancement program. So as an adult critical care therapist, I am the person primarily responsible for managing mechanical ventilation in the intensive care unit. We also manage the artificial airways in ICU, and as well as giving the normal day-to-day respiratory therapies that you would even on the floor. I had to describe respiratory therapy to a high schooler or my high school self. I think that I would describe it as something where you really can make a difference in people's lives. And you also have the added bonus of doing things like troubleshooting systems and using communication skills in a way that I think differs from a lot of other professions. I think that's a really good question, and it's very challenging to do. I give advice to students and new respiratory therapists quite often to not work too much. I think that I see a lot of new graduates make the mistake of working 5-6 days a week because the money is really good, and it seems like it's a huge benefit to you to just be earning money, especially when you have student loans to pay off, and it's nice to be out of mom and dad's house and making the kind of money that we do. But honestly, it's not worth the stress. And I think that taking time to be with my family, to get outside and spend time doing the things that I enjoy has really given me a lot of release from the stress. Yeah, so I think respiratory therapists add a lot to the team. I think that the best way to add to the team is just kind of being the go-to person, right? Because typically there are 15 or 20 nurses in an ICU at a time, but there's only 1 or 2, maybe 3 respiratory therapists in the ICU. So our time is in high demand, and I think that adding good communication to the team and being able to balance a heavy workload helps other people be able to focus on the things that they need to focus on. I think that we add a lot to ICU rounds by delivering an expert opinion on the management of mechanical ventilation and being involved with even the physicians, because new trainees don't understand mechanical ventilation the way that we do. And so we really benefit them by giving that experience and expertise. And so we a lot of times end up playing a role of teaching. And so I think that respiratory therapists as educators, even if you're a bedside therapist and not actually like a teacher or something like that, you still have that role to play in the team. I think the best advice that I got early on in my career, and I would continue to give to people now, is to just listen. As a therapist with 15 years of experience, I still learn new things every day, and I don't think that a shift or a week of shifts would go by where I don't learn something new or something that benefits me somehow. It's really easy to come out of school guns a-blazing, say, I know everything about respiratory therapy and I'm gonna share my knowledge with the world, but that doesn't ever benefit anybody. I think that listening and learning are the things that are key to early success in respiratory care. think the thing that I try to do is add my own personal touch to the care of patients. And so I spend a lot of time just observing, and what I found through just observing patients and the environment in which they find themselves is that I'm able to oftentimes find something like a book or what they're watching on TV to talk to them about. And I could think of even a recent example of a patient's son who was visiting from West Virginia, and I don't remember exactly what started the conversation, but he was really into hunting, and we ended up talking about hunting for 45 minutes. I don't know anything about hunting, but I think that when his sister was in a situation where she was getting ready to pass away, it was comforting to have somebody with the family that could at least make the situation a little bit more relaxed, and they could focus on something else for a little while. So I think that one of the most fulfilling experiences that I've ever had as an adult critical care therapist was in our ICU when a patient that was terminally ill was getting married. And we actually ended up having the wedding in our ICU. And even as the respiratory therapist, the nurses were really busy making the room just right and getting all of the wedding decorations and making sure that the music was on and doing the patient's makeup. And amongst all of that chaos of preparing for a wedding in our ICU, she still needed respiratory care. She still needed breathing treatments. She still needed mechanical ventilation management. And I was there to provide that for her. So even though I wasn't a part of the wedding preparations, I was still a really important part of the day, just because she needed to be able to breathe well in order to take her wedding vows. And she was able to do that and got married before she passed away. And it was just a really special time. And our unit actually won a Daisy Award for their efforts in taking care of her. One of the things that I have learned over the last couple of years in my career is the importance of understanding that we're scientists, that we have a lot to offer in terms of increasing the knowledge base in medicine. And so I think that research has become an important part of my career in the last couple of years, which is really weird because I remember back to my high school days when I hated the scientific method and I thought that biology class was really stupid. And it's become such an important part of my life that it kind of astounds me sometimes that I'm actually have publications in peer-reviewed journals now, and that I'm continuing to seek knowledge and contribution to the field in that way.